Every year, millions of people get an arthroscopy. We think of it as this amazing modern medical fix, right? A minimally invasive way to deal with joint pain. But what if one of the most serious risks is something you can't even see? Today, we're pulling back the curtain on the hidden danger of nerve damage in arthroscopy. Yeah, when you hear arthroscopy, this is exactly what you picture, isn't it? It's the go-to for so many joint issues. And the promise is super appealing. Tiny incisions, way less scar tissue, and you're back on your feet faster. On the surface, it sounds like a perfect, simple solution. But here's the twist. What if the biggest complication has absolutely nothing to do with how small the cut is? We are talking about nerve damage, a totally invisible injury that can happen right there during the procedure, and honestly have some pretty devastating long-term consequences. All right, so here's what we're going to cover. First, we'll dig into this hidden risk. Then, we'll look at exactly how nerves get damaged in the first place. After that, we'll explore the different levels of injury because they're not all the same. Then, and this is the really surprising part, we'll see why the risk is so much higher for some joints. And finally, we'll talk about the path to recovery. Okay, let's just get this out of the way. Well, arthroscopy is, for the most part, incredibly successful. Minimally invasive does not mean zero risk. It just doesn't. And the complications, even though they're rare, can completely change your life. Wow, this quote from the research really just hits you, doesn't it? For a patient, it's invalidating. Think about what that means. For the surgeon, it's frustrating. And for absolutely everyone involved, it kicks off this whole chain reaction of financial stress, emotional turmoil, and even legal battles. So let's be clear, we are not talking about minor side effects here. This is serious stuff. So you're probably thinking, okay, nerve damage, that means the surgeon's hand slipped, right? But it's so much more complicated than that. The risk isn't just about one little moment inside the joint. It's about the entire environment in the operating room, from the second you go under to the second you wake up. It really boils down to two main things. Over on the left, you've got direct damage. This is what we all imagine. A scalpel or a tool accidentally nicks or cuts a nerve. But look at the right. This is the one that's really surprising. Indirect damage. This comes from pulling or pressure, often from something as simple as how the patient is positioned on the operating table. And this is why it really takes a village to prevent this. See, when you're under anesthesia, your body's natural alarm bells are switched off. Your arm or leg could be put in a weird, unnatural position, stretching or pinching a nerve, and you'd have no idea. Even the tourniquet they use to control bleeding can squeeze a nerve and cut off its blood supply. It's a whole bunch of factors that can stack up. Now, it's super important to know that not all nerve damage is created equal. There's a whole classification system that doctors use to describe how severe an injury is. And that severity, well, it tells you a lot about the chances for recovery. Let's break down the three main types. First up, we have neuroapraxia. This is the mildest form, kind of like a temporary short circuit in a wire. The signal gets blocked, but the nerve fiber itself is still perfectly fine. And the great news here is that recovery is usually a sure thing. It happens all on its own, typically in a few weeks, maybe up to 3 months. Next, things get a bit more serious with axonotmesis. Here, the inner nerve fiber, the wire, is actually broken, but the good news is the protective outer layer, the cable's insulation, is still intact. So, regeneration can happen because that outer sheath acts like a little tunnel, guiding the nerve as it tries to regrow. But recovery is way slower and definitely not guaranteed. And finally, there's neuromysis. This is the most severe injury you can have. The entire nerve is completely severed. Think of it like the whole cable being cut clean in half. In this case, there's just no way for it to heal on its own. There's no path for the nerve to follow. These injuries are permanent unless a surgeon can go in and try to repair it. Okay, so we know how these injuries can happen and we know how bad they can be. But here's the million-dollar question. Is the risk the same no matter which joint is being operated on? Well, the data tells a really surprising story. So let me ask you this. Do you think the risk of nerve damage is the same for a knee scope as it is for a shoulder scope? What about a hip scope? You might be shocked by the answer. Just look at this. For a knee arthroscopy, the risk is incredibly tiny, like 0.01%. For the shoulder, it creeps up a little. But then, look at the hip. The risk just skyrockets to as high as 6%. That is a gigantic difference. So what on earth is going on here? This table gives us the full story, and the pattern is crystal clear. Nerve injuries are way more common in the newer, more complex procedures. We're talking hip, ankle, and elbow. And why is that? Well, think about it. Surgeons have been doing knee and shoulder arthroscopies for decades. They've got it down to a science. But for these newer procedures, the techniques are still evolving, and that learning curve makes them riskier. So what happens if an injury like this does happen? I know, it's a terrifying thought, but the medical community has a very clear, established protocol for how to handle these cases to give patients the absolute best shot at recovery.
So, the protocol kicks off with a special test called an EMG to see how well the nerve is working. From that moment on, consistent physical therapy is absolutely crucial. The doctors will check in again at 3 months and then again at the 6-month mark. If, after 6 months, there isn't enough progress, that's when they'll start to consider another surgery to repair the nerve. It's a strategy of watchful waiting, really, giving the body every possible chance to heal itself first.
All right, let's bring it all home. What are the big things to remember? First, the overall risk is low, but it is very, very real, and it changes dramatically depending on the joint. Second, prevention is everything. That means the surgeon has to be meticulous, and just as important, the patient has to be positioned with extreme care. Third, the surgeon's experience really matters, especially with those newer, more complex procedures. And finally, if an injury does happen, there's a clear plan in place. So at the end of the day, the most important takeaway is this: minimally invasive does not mean risk-free. As a patient, the most powerful thing you can possibly do is be informed. Understanding these risks lets you have a better, more honest conversation with your surgeon. So the real question I'll leave you with is this: what questions will you ask? Thanks for tuning in.